everyone. We wanted to hop on here and do our first little episode of Skin Talk. We decided to do this kind of roundtable style. I know a lot of you have been in for consults before and you've heard what we have to say about lasers and skincare, but I wanted you to get a glimpse of what we kind of talk about behind the scenes when you can't really hear what's going on. Today we wanted to focus on lasers because it's laser season and so many people have questions about BBL, Halo, combining both BBL and Halo together and why we would choose one over the other. So we're gonna first start out with skincare because that's the foundation of everything that we do here. We prep everyone's skin prior to any laser procedure. This kind of will answer some questions about when you call, why it's so important for you to come in for a consult or why we need to know what you're on for skincare prior to having a laser procedure, because at the end of the day, we all want you to achieve the best results possible, and we know that we're able to do that by offering you skincare initially and then really ramping things up by adding a laser in. So Amy had an amazing case study, a patient who came in, what was her initial complaint?
Pigmentation.
Pigmentation. And she actually ultimately didn't end up needing a laser at the end of the day, right?
No, she didn't. We just treated her with skincare alone.
And what was her primary complaint?
So she had melasma.
Yes.
And sun damage.
So a lot of times if patients have melasma, they might not know that they have melasma, and we end up doing the Visia images on patients and we see that they have underlying melasma. Some lasers, it's a contraindication to treat if patients have melasma, and that's when we recommend skincare and see where we're at and develop a plan after we see them back, starting retinols and hydroquinone or some sort of combination of those. So when she came in, what did you put her on for a regimen?
So I put her on the Zio Pigment Control kit, which was the Getting Skin Ready, which was gentle cleanser, complexion pads, exfoliating polish, daily power defense, and I had to use the pigment control cream in the daytime, followed by sunblock, and then at night I had her do the same regimen, but we mixed the tretinoin with the blending cream.
Okay. And do you, for the retinol, if patients come in with melasma, do you always use tretinoin or do you sometimes use other retinols?
I typically use tretinoin.
How about you?
For the most part, I've used tretinoin unless the patient is very concerned about their reactions. Sometimes I'll kind of ramp them up from a gentler, more time-released retinol and then take that step by step before we get to the lasers to get them to the point where we can use a stronger retinol.
Yes.
With just using a milder one to start.
And if patients are not achieving exactly what you had hoped with skincare alone and they come in with melasma, they're not a candidate for BBL, what would you recommend at that point?
So my go-to is usually the Halo laser, and sometimes if they don't want something that aggressive, then I would do a series of Zio 3-step peels.
How about you?
Yeah, same thing. The go-to is a Halo or even the laser peel, which that's kind of similar to a chemical peel in terms of downtime. It's sometimes patients are concerned about downtime and whether it's going to fit their lifestyle, so the laser peel is a little less intense, but still they need a series of those instead of just the standard Halo.
And I do the same thing. If patients come in with melasma, I do Halo. We split our Halos in 2 sessions for melasma patients so that they're not getting as much heat as they would typically get with, say, a standard Halo. So we're gonna pause here and show you guys the patient that we were just discussing. This was an example of skincare only on the regimen that Amy just discussed so that you can get a closer look. And these were her results after how many weeks?
We did it for a series of 8 weeks.
8 weeks. And we'll pause here. So patients will come in often and maybe they're not a candidate for BBL or they want something bigger, more aggressive, and we start discussing Halo. So maybe you can speak a little bit to, I always go to Amy because she's our laser guru. if you did not know, Amy's been working with lasers for over 30 years. So anyhow, if somebody comes in and they want something bigger, better, maybe it's texture, pores, collagen stimulation, at what point do you introduce Halo?
So I would still have them start out with a skincare regimen, just because that's gonna get their skin like in a healthier state. So it's just gonna accept the laser and heal better and faster. So I'd still do that for 6 weeks, and then I would have them come in for a Halo.
And Halo is definitely something that is going to require a little more downtime, a little more planning, and we do try to prep the skin a little more adequately than we do for, say, BBL. I mean, we love for everyone to be on our, baseline skincare regimen, which is retinols, antioxidants, and hydroxy acids. But we do add in some additional things like retinols and sometimes hydroquinones for halos. So if a patient comes in and their face is littered with pigmentation and they don't necessarily want to just do a BBL, they want something for collagen stimulation. Amy just spoke about how if somebody wants skin tightening or they have laxity or deeper lines, she's not going to recommend BBL as the solution for those concerns. She will recommend a BBL long term for something like that, but somebody that wants something a little bit more aggressive, Halo will address texture and pore size and laxity and collagen stimulation, but it doesn't do as great of a job addressing pigmentation.
Definitely not.
So if a patient has a Halo, but their face is littered with pigmentation, and they come in, have the Halo, they're gonna look in the mirror and say, the pigmentation is gonna get lighter, but it's certainly not gonna get as light as it would if they had a BBL.
Right.
And so sometimes that's when we combine the two, which we'll talk about in a few minutes. But Amy has a patient that she did a Halo on who had, some deeper lines around the perioral area and the marinettes, and the patient had an incredible outcome. It does a great job at addressing reds as well. So for patients with rosacea or facial vessels around the nose and mouth, it does a great job with that. But the deeper lines, we can map out different areas on the face to do a more aggressive treatment on
Which
those
is what
areas.
I love. Yeah, you can really customize it, so you can hone in on the areas that are more troublesome that patients really want to focus on. So we treated her whole face, and then we remapped the mouth area and just went a little bit more aggressive on that area, and it really did help to lift up and kind of tighten the jawline as well.
Absolutely.
Yeah. With BBL too, I feel like that's more like the instant gratification, and with Halo I tell patients it's kind of like a marathon. Results kind of keep getting better as time goes on, because you get this initial glow to your skin after you complete the recovery process, and then 6 to 8 weeks later you get this glow from an influx of hyaluronic acid, and then 3 to 4 months later you get this new collagen stimulation. So it is, it's not as that you don't get that instant gratification, but you continue to see results over time.
Absolutely. I tell all my patients that. And also, if you're doing this to plan for an event, that is definitely something to be mindful of.
It's definitely, you have to plan far enough in advance
to see the ultimate outcome from all of that. So we're going to pause for a minute and take a look at this Halo patient. So those were pretty amazing results. Don't you wish everyone was as compliant as that?
Definitely. Yes.
So sometimes people think I'm on a retinol that you got at Sephora. What's the difference? Is there a difference?
There's a huge difference. Yes.
So we can talk to you more about that later, but honestly, patients who have been compliant with skincare, once they start, they never stop. There's a huge difference with medical grade skincare versus over the counter, but we'll save that conversation for another day. So patients who are candidates for BBL who show up with pigmentation or texture or maybe some reds from rosacea or just dilated vessels on their face, or just looking for something to do that's quasi-conservative, not a lot of downtime, it's easy to do during lunch or in the evenings without having to eliminate any sort of activities that those patients are involved in. BBLs are a go-to. So Lucy had a patient actually who had incredible results from just one BBL, but we often recommend a series of BBLs? Do you recommend a series?
I usually,
Yeah.
a series of 3,
Yep.
at least.
And the biggest thing that I think patients have to understand is that this is a lifetime commitment, because pigmentation is going to come back. Unless you wore, 80 SPF from the day you were born, you have pigment that's embedded under the surface of the skin. So we can clean up whatever is on the surface, but that pigmentation is going to show up and rear its ugly head at some point. So BBL is a great option for that. BBL is a light-based laser. It finds a dyschromia or a discoloration in the skin, and it vaporizes it essentially. So it's great for reds and browns. And it has a pretty quick outcome with very little to no downtime. So what did you do for this patient?
So yeah, we'll show you these pictures closer after, but basically this patient came in, she's a woman in her 70s that had a long history of tennis, golf, gardening, just a lot of accumulated sun damage for the most part. And it was funny because she's had bangs her whole life, and her forehead was completely clear of most of that pigment, but her temples and lower face had all of this really dark brown sun damage that has surfaced. So just with one treatment alone, we were able to clear the majority of that surface level pigmentation, and she was super happy. But again, like each summer she's outside, she's very active, and that's some of that pigment comes back, and also some of those spots are just stubborn and take a lot longer to fully correct. So it always is, again, a combination of skincare and a series of the lasers to make sure that we're getting that deeper pigmentation as well.
And then Amy, once the pigmentation's off, why don't you speak a little bit to why patients should continue to get BBLs?
So there's a study with the BBL that over time it just changes the gene expression of the cell, so it's going to mimic skin that is a lot younger. So it's going to help to tighten the skin over time. It's not a treatment where if patients originally come in and they're want to treat fine lines, that I say BBL is the go-to. But over time, if you continue having those treatments, the skin is going to act like it's younger and regenerate more healthy cells. Help you purge out the dead cells that kind of just stay there as we get older, and then just help to tighten the skin.
Yeah, and that was a study that was published in the Wall Street Journal. It's called the Stanford study. It came out of Stanford University, and there's just so much more information coming out that's being published about why energy-based lasers are great for anti-aging. So it used to be maybe we would recommend a series of 3 to clean up any pigmentation or reds or browns, and then do follow-up maintenance procedures with BBL annually, or try to get patients to commit to 3 times a year. However, more and more literature is coming out saying that really coming in once a month to pack that energy in is going to have the most long-term benefits. So patients that don't want to dabble into fillers, or maybe are not on board with Botox or any other type of neurotoxin, BBLs are really the way to go. And if you don't have any correction, you don't have any reds or browns, BBLs are incredible because of what Amy just spoke to.
Yeah.
So, and we also tell patients to really include their neck and décolleté, because it looks pretty funny once we start treating the face over the course of a few years, and then all of a sudden
you have this beautiful face and
it doesn't match.
pigmentation. Yeah.
So we definitely recommend that patients, if they are coming in once a month, or even if they're not, you really include face, neck, and décolleté. So we're going to pause for a second and show you Lucy's patient a little bit closer up so you can get a look at one BBL. So as you can see from those images, the Halo really is a good treatment option for laxity, fine lines and wrinkles, texture, pore size, reds, and collagen stimulation. But sometimes patients also need to add in that BBL, like we discussed previously, to address some of that pigmentation. And so in that case, what we'll do is, Amy has a patient that she can talk about with you.
I'll do the BBL first so that I'm really lifting that pigmentation up to the surface, and then do a halo on top of it, so that's resurfacing the skin, so I'm getting rid of like the pores and texture and all that kind of stuff. And when you bring up that pigmentation with the BBL, when you do the halo, it just kind of lifts everything off the skin.
Yeah, it really will deliver knock it out of the park results. And then once that patient has the halo, depending on if there's any residual pigmentation or depending on what that patient's lifestyle looks like, sometimes we'll have them come in for just, you'll have them come in for just a BBL after.
Yes.
Yeah.
Yep.
And not right after, but just like a few months after,
Yeah.
just to
Like
keep
8
working.
weeks usually.
Yeah.
Mm-hmm.
On that pigmentation. And again, not everybody needs that, but if you are somebody who pulls pigment, I personally get a BBL every single time I get a halo because I do pull a lot of pigment. And I know that just a halo alone is not going to be enough. That is something that we would recommend, and that's something that we bundle together. We do the BBL right before, takes like 20 minutes, and then we stack the halo right on top of it. And stacking treatments really ultimately will deliver the best results.
It's really not making any of the healing and downtime any longer
Not
either.
at
If you're going
all.
to be down for 5 to 7 days, adding a BBL, you're going to get rid of that pigmentation
Bundle it
but
in.
have the same amount of downtime with the halo.
And a lot of times patients will ask how often they should have a halo. What do you typically tell people?
I mean, usually it's once a year, and if patients have a lot of laxity and pore size, textures, like kind of off in the skin, they're not interested in doing injectables, then I might say every 6 months for a few.
Is that what you
Yeah,
said?
I usually say once a year for most people.
Yeah, me too.
Unless it's a melasma
Yes.
patient.
Melasma patients, we take that treatment and we basically split the level of heat that patients are getting, and we have them come in for 2 low level energy halos 6 weeks apart. Is there anyone who's not a candidate for halo?
I don't really think so.
I don't think so either.
Yeah.
No. The settings are different. We customize everything, so it's not like a one fit for all type of procedure, depending on like what you're working on the skin, the age of the patient, the skin tone. Like we are really customizing that to everybody's needs. So.
And when Amy talked about mapping out that lower face, that mouth area, oftentimes if patients have any scarring on their face or their lines around their eyes, that's also an area that we can map out and be a little more aggressive if we need to. And you know, I have to just add in that if you have, say, one big sunspot, and some patients think, I'm sure you've gotten this question before, like, can I just spot treat that one area and then do a halo? What would you say to that?
That's not optimal.
No.
Yeah.
You're not getting that diffuse delivery of heat under the skin to really make an impact. Even though you think you're just needing to treat that one area, you need that diffuse energy to get all of that to really lift up. It's just not enough energy to treat one spot. And I would say that that just goes for BBLs as well. If patients come in and they only have 1 or 2 spots.
The other thing too is as you're improving the health of your skin, because we are exfoliating the surface, if you're just doing areas, sometimes it's not going to blend nicely. Like you can have this nice new fresh skin that looks great and then still have other skin that's a little bit duller.
Totally. So we are going to end this by showing you this last image, which is Amy's patient who had BBL plus halo plus skincare, and you can really see her joweling has improved, her laxity has improved. You can see the deeper lines around her mouth have improved. What's your next step for her, by the way?
So we're going to keep her on skincare forever, and then she's going to come in on a yearly basis for halos.
So you guys
and then we'll assess her pigmentation. If she still has pigmentation, we're going to add a BBL to it.
Totally. So if you guys have any more questions about halo or BBL, definitely reach out to us by email or phone. We're happy to answer any questions. We know halos and BBLs can be a little overwhelming if you've never had laser procedures before, but we'll walk you through it every step of the way. And thanks for listening.
Thank you.